Signs and symptoms of inflammation that bring patients into the ED, like a fever or persistent cough, are caused by immune responses. However, it can be challenging for clinicians to establish whether the cause of these symptoms is an infection, and if bacterial or viral. There's now an entirely new way to diagnose infection and sepsis in the ED. A local infection causes a local inflammatory response involving white blood cells and other immune cells. This immune response differs depending on whether the insult is non-infectious, bacterial, or viral. Ultimately, the activated immune cells enter the circulation and can be detected in the blood. From a blood sample, we can measure the immune response by reading the gene expression profiles of these circulating cells. We have identified the messenger RNAs associated with distinct host immune responses to non-infectious inflammation, bacterial infections, and viral infections at different stages of progression from mild infection to immune dysregulation and sepsis. Such tests can aid physicians in determining the presence, type, and severity of infection. Designed for the high-stress settings of emergency departments, the Myrna instrument and TriVerity test epitomize simplicity in a complex environment. Its straightforward operation masks the sophisticated machine learning and host response technologies within. An integrated barcode scanner efficiently handles multiple verifications, checking the test type, cartridge validity, sample ID, and expiration date. A patient-drawn tube is inserted into a single-use cartridge, and the test begins with a single touch. The test system requires minimal interaction. Operation is deceptively simple, streamlining complex processes to facilitate quick, accurate diagnostics. TriVerity uniquely determines both the presence of infection and the severity of illness, offering crucial diagnostic and prognostic insights in patients suspected of acute infection or sepsis. The user interface, free from clutter, features intuitive prompts and animations, catering to different user preferences and highlighted with consistent design language for essential actions. The streamlined approach not only reduces cognitive load, but also encapsulates all necessary supplies and waste within each consumable, enhancing safety and usability. By empowering clinicians to manage sepsis across a spectrum, from identifying occult sepsis in critical cases to confidently discharging those at low risk, TriVerity aims to support comprehensive decision-making in patients suspected of acute infection or sepsis, promising to significantly enhance patient outcomes where every second counts.